promised, I am back now to start doing a series about PEMF and the actual applications and conditions that it can be used for. So I figure a good place to start is going to be with pain management and swelling. This is a big topic because this really covers a vast array of people and conditions. So pain problems can be acute or chronic. So whether we suffer some kind of a trauma that's just happened, like breaking a leg or a surgery, or whether it's chronic, like we have arthritis or fibromyalgia. In the same vein, this can also be local or systemic. So is the issue just limited to one part of our body, or is this something that we feel that kind of moves from place to place, or it's just an overall feeling of pain throughout the body? Pain affects roughly 15 to 25% of the population and really impacts the daily quality of life for a lot of people, and is one of the leading causes of people on disability. So traditional medicine has treated pain with using physical therapy, rehab, and other modalities, as well as offering surgery for some issues or medications to mask the pain and sort of numb the issue. One of the most common ones that we see used is non-steroidal anti-inflammatories. So these are things like Advil and Tylenol. These can cause a lot of problems in the long run. They are pretty hard on the stomach and they can cause gastrointestinal bleeding. And generally they only just mask the problem. They do nothing to fix the underlying condition. We see other issues with opioids now. So Percocets, Vicodin, Oxycontin, morphine and other opioids used that are increasingly effective and dangerous, but effective only in the sense that it's masking the pain. But again, it's creating a cycle of pain, because a lot of times when people try to reduce these pains or come off of them, the pain meds, they get such an addiction withdrawal to them that you're not really aware anymore if the pain is caused by your condition or is it just the withdrawal from these medications. And then you see addiction issues, and I'm sure that we all now have somebody in our family or know somebody that's been affected by the opioid crisis. So these things only stop the pain just temporarily, and they aren't really good long-term fixes for us. So PEMF can work very effective to reduce pain. Today I'm going to be reviewing just one specific study, which is about post-operative C-sections, but I want you to be aware that this really extends to almost everything. And the reason I picked pain is I do know quite a few family members who suffer from chronic pain. And I've also, one of the first things I ever used my PEMF device for was for treating pain just on my local family members. So I used this to treat someone who had fallen off of scaffolding, and I got severe pain and swelling, bruising in his arm. And with just one treatment overnight, the bruising went from black to just gone. It didn't go through all the shades of blue and green and yellowing. It was just gone. And the pain as well was greatly reduced. Also using this for pain of growing pains for children, other types of things too. So keep that in mind, that even if you're not a woman and if you're not pregnant, this study is just one of many that just show the potential of PEMF. So the method in this study, it was a randomized double-blind placebo-controlled trial, which is the gold standard. It included 72 women who underwent a C-section, 36 that were on the PEMF, and 36 that were on a sham PEMF device. The participants were asked to report their pain intensity on a visual analog scale. They were doing this at 2, 4, 6, 12, and 24-hour periods, and then doing that at the 2-day, 4-day, and 7-day mark after their surgery. The amount of analgesic that was used was recorded, and the surgery site was evaluated afterward to assess the wound healing process at the 7th postoperative day. I found this part interesting as well, because even though we're talking about pain today, this is also covering swelling, edema, right, and the wound healing as well, which PEMF does all of those things as well. So the results of this, so post-operative, the visual acuity scale score, it was significantly lower in the active PEMF group on all measures period within that. So at the 2, 4, 6, 12 hours and the different days that they did it, at all those periods, they were measuring a benefit. So fewer women in the active PEMF group experienced severe post-operative pain within 24 hours. So it was 36 compared to 72 of those in the sham group, which is pretty significant. The total amount of pain medication that was used during the 7th postoperative day was 2.5 times lower in the active PEMF group than the sham group. 7 days postoperative, patients that were using the active PEMF group had better wound healing. And what they're talking about here is oozing and redness at the site, as well as swelling. So those are just medical terms for those things. I wish I had known about PEMF. My second and third babies were born emergency C-sections, and I had a lot of issues with mine. It opened again. It didn't heal very well. The scars were very painful, especially for when you have other children and you're still picking them up and you have other things to do. You don't maybe rest as well as you should have. Knowing this, in hindsight, it would have been great. So the conclusions of this study showed that PEMF treatment after C-section decreased post-surgical pain. It also decreased the amount of drugs that were used, and the surgical wound, the redness, the swelling of it, the oozing of it was significantly lower. And it was associated with a higher level of patient satisfaction. So these women in general just felt better about the overall process of their surgery and how they healed. So I don't know, this is pretty significant, I think, and it's also shows like a C-section is quite a big injury. So it goes through all parts of your body. And because these women generally don't have a lot of time to rest after this because you're nursing a baby, you're up all night, it really is a difficult healing process. So to know that this PEMF could do so much was fantastic, because think about if you were able to have an injury that you were really able to rest it, and how much better the healing might even be. So how PEMF reduces pain. So the edema and the swelling that accompanies a lot of chronic and acute injury, it is reduced. And so the swelling in itself can sometimes cause pain as well. So anyone that's ever hit their finger with a hammer or pinched it in something, and you get that throbbing feeling from the swelling and the uncomfortableness of a swollen ankle maybe when you've sprained it. It also reduces inflammation. And so inflammation, although it's necessary for us because it does go in and it stops and sort of puts a brakes on things, it can get excessive and out of force, and then it causes its own set of problem and pain. PEMF can also calm nerve signals, but at the same time, it increases nerve growth factor. So this has been studied in other research papers, and I think that this is also, they didn't talk about it in this particular study, but having had C-sections myself, you get a lot of numbness and loss of sensation in the area after surgery, and sometimes it doesn't come back. And so I think that if this was something that was offered to women, it's something that somebody should look into and maybe study in the future, is can it actually allow that area to regain normal sensation afterwards? So I think that when you're thinking about treating something like this kind of surgery, it's best to apply something to a local area, a PEMF applicator. But I think that considering how pain works in the body, you have in the local area an injury happens, and the sensory nerves, they move that pain signal up to the spinal cord, up into the brain. The brain processes it and it sends it back out to the body to move away from the pain, to accommodate by maybe limping or not putting weight on something. And along that system, it's very possible for you to get stuck in a pain loop or a signal. So when that happens, if you're treating the spine and the brain as well, it's really beneficial. It's going to help in case the pain is not really in the area anymore, but it might just be now just in the brain, as opposed to the actual C-section scar or the swollen ankle or the cut on the finger. So treatable ailments are almost endless, because the pathways to pain is the same across various conditions and illnesses and injuries. So, pain's the pain of a burn might feel a little bit different than a cut, but the same type of mechanisms are going on in the body, and those mechanisms can be treated equally by PEMF. Well, I hope that you found the first video on pain and PEMF informative, and that you learned something new today, and that you're willing to maybe give PEMF a try if you suffer from any condition that is limiting the quality of your life, because your pain is manageable and treatable, and you don't have to continue to suffer. So if there's anything that you would like to cover more of, or a different topic, please leave a comment below. I'll review it and I'll try my best to cover whatever it is people are interested in talking about. If not, we'll probably follow up with another video on pain, because there is so many ways to look at this, and cover something of more of a chronic condition. So fibromyalgia, arthritis, something that impacts so many people and really reduces the quality of life, which isn't necessary. Also subscribe below so that you make sure that you get any notifications for anything future. Also feel free to check out the website at energyovermatter.com. Thank you. Have a great day.